What if the bubbly, maybe even precocious chatterbox you knew at home wasn't the child the rest of the world heard? Would you know if your child spoke differently when you weren't around? What if you were actually on track to being much, much more than just shy? Meet 4-year-old Anne. For a few years, she'd always been less talkative outside of her family. Her goofy gesturing for the first hour definitely drove Grandpa a bit crazy every time he visited, but her parents were trying their best. They'd often jump in and answer for her if they saw she was uncomfortable. Wasn't that the right thing to do? Then, 6 months into preschool, Anne came home one day with a huge bite mark on her arm. Surely she must have told the teacher or told the classmate to stop, right? But no, she hadn't. Anne hadn't said a single word. That's when her parents realized that although she usually came back saying she had a good time and teachers hadn't mentioned a problem, Anne was hardly talking to anyone the way she talked to her family. The teacher actually thought Anne was a good candidate to repeat the year. Her parents were stunned. Maybe Anne was so smart that she was just very picky about who she talked to? Doctors and nurses had never seemed alarmed and often joked, "Who drank the shy juice?" Most people just tried to convince themselves she would grow out of it soon. But only some children will grow out of this quickly. Others will avoid speech more and more and will go years without talking at school. Hoping it will all go away is simply not worth the risk. This is not a fictional story. Unlike children who are just shy, who might take an hour to start talking with someone outside the family, or a month or two to warm up at school, up to 1% of children will develop an anxiety disorder called selective mutism, or SM. Some experts prefer to think of SM as a symptom of social communication anxiety. These children become persistently unable to speak normally in certain social situations. Be on the lookout for children who adopt a deer in the headlights look or frozen body posture when spoken to. You might see a lot of gesturing instead of speaking, or speaking through an intermediary. Some may only quietly whisper one or two words. Many resist eye contact and may not ever ask adults for help. It is easy to misinterpret all of this as willful defiance, a sign of autism, a sign of abuse, or even low intelligence. In fact, SM symptoms can mask high intelligence even in young gifted children. In general, none of these are typical reasons for SM. On the other hand, there is genetics. It is not uncommon for a parent to reflect on their own history with social anxiety. Shy, slow to warm children are at a higher risk, and multilingual children may be as well. Many children with SM are very sensitive to their environment in multiple ways, and a significant percentage have a subtle speech or language disorder, which parents might easily miss. Anne had 4 of these risk factors. So, what do we do? Well, first, let's look at a typical pattern that might be familiar. A child is prompted to engage, which causes her distress. Others sense this distress and come to the rescue so that everyone can feel relief. The child learns that her anxiety can be reduced by not speaking. We are going to break this pattern. Here's a few examples. In social situations, avoid asking open-ended questions, which require a lot of thinking, as well as yes-no questions, which encourage nonverbal responses. Instead, ask and encourage others to ask forced choice questions. For example, would you like the cheese or the pepperoni? Wait 7 seconds for a response before asking the question again. If he answers, great. If not, maybe see if she'll tell mom as an intermediary. Ask yes-no questions as a last resort. Also, try not to go into social situations without warm-up or preparation. Instead, model and practice common situations at home in detail before you go out. For example, play restaurant and make it a fun game. At the other extreme, don't avoid social situations or rescue by answering questions for your child. The goal is to desensitize them with frequent exposures that allow them to experience small successes. One-on-one interactions at home can be a good start. And don't be ashamed to involve others. Ask someone friendly to read some forced choice questions that your child has practiced answering with you. SM can be exasperating. It's easy to resort to begging or demanding, but this is probably going to do little except for increase anxiety. Instead, aim to keep communication environments low pressure. Work on developing trust and comfort using something called pride skills. The best strategies to help may depend on what factors are contributing to SM and should respect the child's baseline communication level in different situations. Check out the resources at the end of this video. If you see persistent symptoms, try to find someone who has treated SM not just with play therapy, but also with evidence-based behavioral therapy. Print out the SM Association's Educator Toolkit and plan to give it to your teacher. Teachers have so much to deal with, but these strategies can go a long way to making their life easier. A diagnosis can also allow your child to get legal accommodations to help them succeed in school, even for intellectually gifted children. Behavioral treatment can be very effective. In one study, children were assigned to either a 5-month therapy group or a 3-month waitlist. After 5 months, more than 2/3 of kids who got therapy no longer met SM criteria, but none of the waitlist group had made significant improvement. Treatment is often shorter and more effective for youngsters. As a parent, you are the expert on your child, but how sure are you really that he's going to grow out of it soon? And what are you willing to risk? Talk to the pediatrician and take a look at these resources. They include free training you can use at home, a toolkit for educators, and a great podcast from a national expert. Anne and her family are so glad that they didn't wait.